Hey, I'm Regush. I'm an obstetrician gynecologist in Saskatchewan. So I did a project looking at postpartum hypertension, and we really didn't have consistent identification and care planning for these patients. And my goal was to reduce the return to emergency with hypertension-related issues. And since there was this lack of consistency in care and discharge planning, I thought it would be really smart to have a protocol that could be implemented, even starting with an RN-led protocol that be efficient and consistent and make everybody's job really easy. And then we did the data review, and then we realized that we actually couldn't tell who was going to be hypertensive and how do you apply a protocol to people at risk that you aren't identifying. And looking back through the data, retrospectively, there were a lot of clues, but a lot of people either didn't cross the threshold for hypertension but had 5 clues they were going to, or they kind of crossed the threshold, but we just didn't really act on it. So since we didn't actually have the source of the problem identified, we took one step back and became a whole new, entirely different project. We realized there were huge gaps in patient care due to lack of vigilance in the recognition, and part of the problem with my job is that a lot of people presume that birth is just a natural and physiologic event, and things don't go wrong, of course, with a natural and physiologic event, which of course those of us in the profession are employed because it does all the time. So these are common errors in healthcare provider thinking, and we needed a plan to reduce these assumptions. So what I learned is that sometimes what you think is a problem probably really is a problem, but the source of the problem may not be quite correct. And in a complex system, solutions are best arrived at by a team. Everybody knows a piece of the right answer, but without engaging these people, you probably aren't going to succeed, and you probably won't come to the right conclusion. Persnickety team members are actually important team members. They make it difficult sometimes. However, if you can make them happy, then you probably have a really good project. And that was wisdom that I had gotten from my coach, and it really is very sage advice. Data collection can be absolutely overwhelming and hideous, so when employ help, there are people who know more than you do, people who know what to do with the data, and without some kind of a plan, this can be really a difficult part of the project. For me, health records data collection wasn't possible, and we needed to find a creative solution. I am lucky to have a residency program where I work, and that this will be a very good project for a resident to be able to publish, and so with that, I was able to get some really excellent help that way. Everybody on the team has a what's in it for me. Even though everybody looks forward to this goal and this great project, if they don't see what's appealing precisely for them, they lose sight of the goal and they disengage. So, and it can't be too onerous for one team member. It can't be, we're going to fix everything and the nurse has to do it all. Otherwise, you're really going to lose out there. The balancing measures really do need to be considered. And for example, it came up that what if this affects our time to discharge? So it's not okay to discharge people who aren't well, but if it was going to make them stay in hospital longer, that was still going to be a problem. This is, as far as I know, is the first time that there's been a physician-led quality improvement project in our department. And for me, it was interesting to come to the realization that as physicians, we actually really are important in this process. My project wouldn't have been able to be done without it being led by a physician. We have a relationship with the patient, we have that sense of importance, and we have a broader system view, but it's really hard working the way that we do. The patients keep you on track, and they're very important to have on the team. My team, that's it, thanks.